Patient symptoms are most likely due to ischemia of which of the following brain structures? Okay, so the neuro questionnaire, 62-year-old man, history of uncontrollable hypertension, presents sudden onset left-sided weakness and slurred speech. Patient appears alert and oriented. Non-contrast CT shows small area of hypodensity in the right basal ganglia. All right, well, if he has a hypodensity there in the right basal ganglia, he has left-sided weakness, slurred speech. Okay. Due to ischemia, which of the following brain structures? Basal ganglia. I was first thinking, okay, so thalamus is gonna, internal capsule is gonna cross over. It's gonna be like movement, but he has weakness. Brain stem would be more of like breathing issues. Medulla oblongata. Frontal lobe would be cognition. He seems to be alert and oriented. He's okay there. Cerebellum I like but not, doesn't make the whole picture. Internal capsule also makes sense to me here. Let's see if we can do some brain structures. Let's see. I'm down to, I want to say maybe internal capsule here.
Okay.
That's just my gut, and I don't really know why.
Okay. So let's go with your
Okay.
gut then, huh?
Yeah, let's go with it.
Okay, good. So internal
Okay.
capsule, right? It's actually in particular, it's not exactly in the basal ganglia, it's right around it. But
That's what I thought, because I'm like basal, like internal capsule, I'm thinking of like Huntington's and
mhm.
all those like movement disorders are like in there. So
Yeah. The main thing I think it deals with, you're gonna have some weakness, right? Maybe some slurred speech, right? And it's usually the motor and sensory fibers connecting the cerebral cortex of the brainstem to the spinal cord, right? But let's talk
okay.
about cerebellum can't be it, right? It's usually balance issues, right? So ataxia and
Correct.
nystagmus,
Yep.
vertigo. Thalamus is usually sensory defects, right? So no
Mm-hmm.
motor defects, but it is also in the basal ganglia. Brainstem, not really in the basal ganglia, right?
Mm-hmm.
But you can have
A little
hemiparesis.
lower.
Yep, lower. Frontal lobe, right? You can have some motor deficits, but usually not going to be, the frontal lobe is not deep enough in the brain, right? So the only one
Right.
that has kind of the motion issue, and then, it's not per se exactly in the basal ganglia, it's a little bit around, but the internal capsule is going to be able to match the best here.